Friend, this is Dr. Apurv Mehra. I am starting with Monday motivation today. What an auspicious day to start it. Happy Lodi to all of you. Now, the topic that I have selected today is passion versus compassion. What is passion? Passion is something that drives you towards what you want to do. Compassion is being comfortable with something. So I'll explain to you in a different way. Let's take that we are preparing for an entrance exam, right? Yesterday was FMG exam and now we are rooting for INI, CT and NEET. So if I want to prepare for an exam, I will have an option of completing 19 subjects. Those 19 subjects, when I try to read or when I try to do, all right, I will have option number one, I completed. So option number one of doing the 19 subjects is completion. All right. So what is completion? Completion is that I go and I choose the important topics. I know that this is my checklist for 19 subjects, right? And I read it. That's completion. Second is creation. Creation is being passionate about understanding how to extract the maximum in those 19 subjects. So I have thought of an example in different series which I will explain to you. Let's take out the principle of sugarcane juice. You have to select out the most important things that you need to study in every subject. All right. So that is number one. So number one step is select the sugarcanes. So when the sugarcane juice is coming out, you will select the sugarcanes. These that this is the time allotted for me and I have to do these topics. So this is correct sugarcane taken out. And then the first thing, you want to take out a sugarcane juice, you put the first sugarcane in the machine and it takes out the juice. This is step one. So you have done the important topics. That's your layer one. And you know what people think? This is the appropriate thing to do. This is enough. For example, I'll give you an example of shoulder dislocation. The most common type of dislocation of shoulder is anterior. It is the most common joint to dislocate. Now, the second question, which is the most common dislocation to occur in the epileptic patients? Now, here people will answer, it is posterior dislocation, which is a wrong answer. The most common type of dislocation to occur in epileptics is also anterior dislocation. But when the question is reversed, that posterior dislocation occurs in what kind of population? The answer is epileptics. So when you have a patient of posterior dislocation, you will either have electric shock and epilepsy as a cause. But when you look at an epileptic patient, even in that, the most common type of dislocation is anterior. So this is called as a boom thing. Now this is something which is a difficult one to get. For this, you have to go to the second layer. The second layer is when the first sugarcane has gone out, you take it out, you double fold it and you again put it in the machine. Now more juice will come out. Now that's what is second layer. Second layer is your topic is the same, but you develop knowledge around it. Then comes in between the first and the second layer. Then comes a very important third layer. What is the third layer? You do MCQs. MCQs of the first layer, and if there is a present MCQ of the second layer. So what you're doing in the third layer, sugar canes are rebundled, you put lemon into it, you will put some mint leaves into it and again put it. That's the time when more juice is going to come out. So this is layer by layer approach. You do PYTs, you do their questions. That's the first layer. You need more topics, do their questions, and you understand doing the MCQs of both the sections, because finally it's an MCQ exam. It's not just about knowledge. It is an art and craft acquired with practice to take you to the next level. If it would have been just knowledge, then university toppers would have topped all the entrance exams, and supply holders or people who got less marks in the exams would not have got very good exams in the entrance exams. But that's not the case. We see that every year the tables turn. And why? because there are some people who have a knack of it. They understand how to solve the questions, and that only comes with practice. This is very important, right? If you don't practice well on the pitch, you can never perform. That's why the net practice is very important. Many of the students can answer your questions in the classes, but when it comes to giving the real exam in front of the computer, they fail. And that's because they don't take care of the MCQs, the second layer, and their MCQs. And then comes the last layer, the fourth layer. Fourth layer is when you know that enough juice has been taken out, you have the knowledge, and here you want to throw away the sugarcane. So you want to get away with the sugarcane. So let's understand in a different way. I have to read ortho in 2 days. I'll pick up the sugarcane. I'll select out the important topics. I will do that, for example, the nerve injuries. If I see the dorsum of hand, sensory distribution here, that means we are talking about radial nerve. If the first 3.5 fingers, sensation loss or any paresthesia, median nerve, carpal tunnel syndrome. If the last two, fourth and fifth finger clawing, which came in FMG exam yesterday, we are talking about the ulnar nerve. So all these questions came yesterday. This is what is the first layer. Then you do MCQs and you learn to solve them in this layer. The second layer, the median nerve has a branch called an anterior interosseous nerve, and it has a sign called as wow sign or OK sign, also called as Kilo-Nevin sign. So you learn about anterior interosseous nerve, the branch of median nerve, or posterior interosseous nerve causing finger drop. A question that came in the recent INI-CET. Now this is something is the second point that you should cover out. Then integrate MCQs around it. Most common nerve damage in anterior shoulder dislocation, axillary nerve. The second layer, most common nerve damage in posterior dislocation, axillary nerve. Third layer, right, which is the second common nerve in shoulder dislocation. Answer is musculocutaneous. Now that's your third layer. And the last one, I have 2 days. I have done the important topics. I have done the second layer. I have practiced MCQs of both. And now I want to move on to the next subject. My day is over, revise and go ahead. That's called as the sugarcane principle, that you need to pick up the right sugarcane, the topics, do it layer wise, and you need to know when to get out. People who do well, they know where to stop. And stopping is extremely important to gain in life. If you don't know where to stop, it is going to be very, very tough. So my point is very simple here. You are not going to complete a course. You can't do that. If you are good in one subject, you might not clear it. But if you're an average in 19, you might be rank 1. Your aim is to create an understanding of doing MCQs. Completion has never got anybody anywhere. It is the creativity and creation in everything that you do defines what you do. You can be compassionate that I want to do something, relaxed mind. But if you are passionate, you will take it till the end and you will kill it. All the very best. Thank you very much.